when you talk about Pomi-T, that's a whole food supplement. When it comes to cancer and treatment, do you think, speaking of food, that nutrition in general is still kind of overlooked by people and maybe even some doctors?
I'm not sure about the States, but certainly in the UK, the dietitians are very much regimented into, you look at the levels of vitamins and you compartmentalize foods into protein, carbohydrate. They don't tend to look at sort of polyphenols and antioxidants. They sort of rather poo-poo them. And so, yes, I think it's been completely underestimated. I'm a UK oncologist, so I see 40 patients a day in busy clinics, which is obviously stressful. But on the other side, I get to see a lot of patients, and I hear what they have to say. And it's not infrequent that I can get a man with, say, metastatic bowel cancer, or something which is terminal, and we're keeping chemotherapy back. And they've gone out and they've really made strong efforts to change their lifestyle. So they exercise 3-4 hours a week. They cut back on the carcinogenic foods, such as burnt toast, etc. They then go out and either take Pomi-T or sort of eat lots of herbs and spices. And, it is dramatic, the changes you see. Now, of course, that's anecdotal, and it'd be very difficult to do a trial in this group of patients. But I've never seen someone go out and do these things and come back saying they feel worse. They always feel better. And, I've probably once a fortnight, I come back with a CT scan showing the disease is smaller. And even if they eventually need chemotherapy, you have put off that chemotherapy for maybe 6 months or even a year. And that's been a year of good quality of life. Now, if a drug had done that, everyone would be tapping themselves on the back, and the shares of various pharmaceuticals will go through the roof. And and that's the problem. Nobody's winning financially in that situation apart from the patient. So yes, in answer to your question, I totally believe that self-help strategies and lifestyle will have a major impact on people, and it's situations like this where you're trying to put the message out to the world, and conferences like this is where we're going to get the message over. But we're not going to get the message over by developing licensed lifestyle therapies, because it's just not going to happen.